live. How exciting, everybody. Let me just make sure that everything's working, because this is very new to me. So, good, that all looks... Ooh. We'll just make sure that this is all looking good. Fine, no problems there. Hello, hi Billy. Making sure everything's working. It looks like it, which is fab, given that I haven't done this before. Brilliant. Okay, I think I've got this all working. If I haven't, I apologise now. And next time I will do better. Or try to do better. Who knows? Hello everyone. Hope you've had a good weekend. I hope you took my advice and got yourself a cup of tea. Or if you didn't get a cup of tea, got a glass of wine. I'm obviously not allowed a glass of wine. Not because of dry January, but because I'm pregnant. So I did pour myself a non-alcoholic drink, which does look like and taste like glorified apple juice. I could have just put it in a normal glass, but they're all in the dishwasher, so I went for a wine glass, which does look very bougie, but yeah. So it's not alcohol. I'm not going live drinking, okay? So yeah, my name's Victoria, which you've probably guessed by now. I'm a doctor. I've been working as a doctor now for 10 years, which is a bit scary. Yeah, really gone quickly. Done a lot of different specialties, mostly surgery. That's my area of expertise. And in that time I did mostly ENT, ears, nose and throat. I've also done plastics, reconstruction surgery. I've done trauma surgery in a trauma centre, so helping to reattach limbs and deal with machete attacks. So I've done a lot of different things. But what I really, really love is facial aesthetics. So providing people with excellent skin health, looking after themselves, looking after their body. The skin is the largest organ, and if you don't look after it, you won't get another one. So yeah, so that's my passion, and with that I incorporate a lot of different things. So I do a lot of skincare, I do a lot of skin treatments, and I also do aesthetic treatments. So with that comes things like Botox, things like fillers, polynucleotides, but I'm very different. Hi Capri, nice to see you. But the reason I'm different to other people that are in the industry is that I believe that you should get to know me and I should get to know you, and we follow you on that journey all the way through. I think at the moment there's kind of a feeling to treat it like a generic treatment, like you're having, I don't know, having a facial. And the way I see it is, if you needed, for example, I don't know, your appendix taken out, would you just go down the road, book yourself in, have your appendix out? Or would you actually get to know the person, ask them if they're qualified, if they're insured, if they know what they're doing? And that's how I see aesthetics. You should get to know me. I should get to know you. I should get to know your needs and what your skin needs. And then we go from there, really. And we work together to get the goal you need. So I do skincare for the face. I don't do it for the body, Lorna. That is something I am looking at doing in the future. But as a new business, coming from Horsforth, but obviously I do virtual clinics for anybody across the country. I have to gradually introduce different things, depending on what people need and what people want. So never say never. I could potentially be doing Body, especially, I really want a laser. Laser would be amazing, but we're not there yet. Eventually that would be perfect, because I would love to be able to do hemangiomas, port wine stains, and helping with that as part of skincare. But at the minute, it's there, but we're getting there. Thanks, Ella. Proud of you too. Sorry, I know quite a few of the people on the live, either because they're my patients or because they've been told they have to come on here, because otherwise, if no one comes on here, I will be talking to myself, which I do quite a lot, but, you know, there has to be a limit, doesn't there? So, yes, so that's me in a nutshell. I mean, I could go on forever, but who wants to really listen to me talk too much? Oh, thanks, Lorna. Oh, I'm glad you're happy with your skincare. We'll definitely be catching up soon anyway to make sure you're on the right track. So discussing how the clinic works, you have two different types of consultation. You've got your face-to-face, which is where you come in, you see me. It's an hour long. You lucky people, spending a whole hour with me. And what I do is I take a full history. I examine you. I see how your skin is, what your health is like. Are you on any medical medication? Are you got any conditions that might be impacting your skin? And we work all the way through that. And then I analyse your skin. Now, I don't have any of these fancy lights that laser your face so that you can work out what kind of skin damage you have. I am the skin analysis, and that comes from years of experience and training as a medical professional. So I analyse your skin, we take some photos in the face-to-face. Don't worry, they don't end up on Instagram unless you really want them to. And what I do with those is it allows me to use that as a base to then work out where you're going with your skin. And then once we've done that, we sit down and we discuss what your wishes are, what's your budget, and we go all the way through to injectables if need be. You don't have to have an injectable if you don't want to. Not everybody wants it. No, not everybody wants to be stabbed in the face. That is completely fine. I can work around that. And we can discuss lots of different options that would be useful to you. And yeah, then we work out a plan. So if, for example, you were just doing skincare, then we would do it for 4 weeks, 4 to 6 weeks, and we will book you in for a follow-up and see how you're doing. If we need to adjust things, we'll adjust it there and then. If we decide at that point, okay, we've got your skin nailed, but we need to start introducing chemical peels, needles to try and cause more skin rejuvenation to happen, that's when we start thinking about that. Or if you've already got very good skin and it's not about health, but it's more about the aging process or areas that you're not happy with, for example, scarring, then sometimes we organise a bespoke treatment treatment plan for about 3 months, 6 months, whatever you need. And then we work all the way through and we tweak it as you need. Every treatment plan I do is completely bespoke. There is no such thing as just getting a one size fits all. Oh my God, honestly, this isn't just apple juice. This is not wine. One size fits all program with me anyway. It's not how I work. It's not how I roll. I don't think it's right. Everyone's different. Everyone's an individual. And that's me personally. And I think that's the way we should go with aesthetics and skincare. I don't think you should be able to just book in for a facial that's going to potentially be for resurfacing without actually seeing the person that's going to do it, because side effects do happen. And you might come in and say, I think I want this, but then when I see you, I go, why do you want that? It's not going to work. We need to change the plan, and that's not what you booked. How on earth are we going to do this? And that's why we have the face-to-face consultation. It means that you can invest in your skin and your health early. It means you're less likely to have a mistake or an error. And also, it makes you happier overall. And I'll put this in now because that just makes me look like I've got this all trained all up and I'm not improvising. But that is why we're the Happy Skin Company, because we want you to be happy with your skin. We want everyone to come out thinking, wow, I am so happy. I'm so much more confident in how I look, which doesn't always happen, especially if your expectations are so different to reality. So that's one option, face-to-face. Well, I was going to say long story short, but it wasn't actually that short, was it? And then you've got virtual consultation. So that's when, for example, you live far away, so London. I know there's a few from Cornwall on here. I've seen you. Hi, guys. And what you do is you book in with me. We do either a Zoom, a Google Meet, a Teams meeting, whatever you fancy. And that's still an hour long. You get loads of forms to fill out at first. I do apologise, but it's all to make it slicker as part of a virtual meeting. I go through everything you've written on there, on what treatments you're having, what treatments you've had in the past. Have you had Botox? Have you had fillers? What's your skin routine at the moment? What medication are you on? And we look at the photos that you've sent me in advance of your skin. Please, if you do send me pictures of your skin, please do it without makeup. Please. I've got like 2 layers of foundation on today because I knew I was going on screen. But no one's judging my skin. Well, you probably are judging my skin. But no one's examining my skin in order to provide a skincare service. So please make sure that when you join, I want bare-faced beauty, I'm afraid. And if you come to see me in the face-to-face, I want nothing there. Okay, because I need to be able to see your skin properly at that point. So once you've gone through all of that, we then do a skincare plan. Now, if you want injectables, you need to have a face-to-face, because I'm happy to organise skincare if you are at home and you're not planning to come in at any point to have injectables. But if injectables are on the horizon, I need to see you. If you do live far away, I can adjust it in that I would see you for a face-to-face and then we would do the treatment afterwards. So it would be a longer appointment. And you have to run the risk that if, for example, something's not right on the day, I might not be able to proceed with the procedure. Not because I don't like you and I don't want to do it. It's because there's something wrong. So, for example, if you come to me for filler and you say to me, oh, Victoria, this is amazing, I'm so happy to see you, because that's what you're going to say. But in 2 days I'm going to Thailand. I'm not filling your face. I'm sorry, you need to be in the country, because if something goes wrong, I need you to see me. I don't want you seeing someone in Thailand. So that's the kind of scenario where I might not go ahead. But otherwise, as long as we're both on the same page, it shouldn't be a problem. So that's mainly it for the face-to-face and the virtual consultations. For skincare, I use Illumier. I love them. They're absolutely fantastic. They do medical grade products. They focus on the science, not on the packaging and the marketing, which I find a lot with a lot of high street products is they're, all the razzmatazz of what's on it, and it's not going to help you, so why waste your money? That's how I see it anyway. So I do use Illumier. However, I work with other people's budgets. So if, for example, you say to me, Victoria, I really need help with my acne, but I can't afford it at the minute. I really can't. I want to invest in the future, but at the minute I have no routine. I don't know what I'm doing. There's so many different things on the market and I don't even know where to start. Don't panic. I will give you a full list of medical grade products as well as high street products. Now, the high street products aren't going to be as great because they're not medical grade. And why by that I mean they're not as effective as quickly. But if you're dedicated and you keep going with it, and we keep adjusting it as and when you need it, there's no reason you can't get a good result. You may not get an excellent result because that's where the medical grade does chef's kiss, but you know, that's what you have to take into account, unfortunately. But I'm more than happy to work with any budget. It's not a problem at all. So that's the consultation. And then at the moment we've got a list of different treatments. So my chemical peels are predominantly Illumier, but depending on what we're needing, I can sometimes go deeper, so I do deeper chemical peels, but it's really dependent on the person and what skin they have, and what we're trying to achieve. That wouldn't be an Illumier product potentially, that might be something else, but I would talk you through with that. And I do microneedling, I do mesotherapy as part of microneedling. I do fillers, I do botulinum toxin, or Botox as it's commonly called. Again, that is on consultation. It is a medical drug and I do not provide it unless I am absolutely sure it is going to be good for you and it's safe to do so. And I do skin boosters, and well, this year we're going to be bringing in some more fun, exciting, different products. For example, polynucleotides, which I'm aiming for towards the end of Feb, beginning of March. So if you are interested in that, DM me after this and I will put you on a waiting list so that we can get you sorted. But still, you would need a face-to-face consultation to make sure it's appropriate for you, okay? Because it might be that we do it, but we do it at a later date. So, well, I don't think I've come up for air, have I? I'm going to go drink my apple juice in my wine glass. I can see a couple of you have joined now. That's good, because I've done about 15, 16 minutes of constant talking. I don't know how my husband copes. Is there any questions at the minute? Otherwise, I will on to all of you, because I'm really good at talking. I can talk for England. I should have been in the Olympics for it. Let's see, any ones coming up? I can see who's following. Not at the moment. Fine, I will carry on talking, but please, if you do have a question, just write it in the comments and I'll talk specifically about that. It's not a problem. Or even if you just want to say hi. Otherwise, I am literally talking to myself, which is a bit odd. So we've talked about that. They're the main bits. The other thing just to explain would be how I work with the booking system. So there's a booking link on my website, on my Instagram and on my Facebook page. You click on that and there will be slots available. It is limited purely because I have other commitments. However, if there is something specific you need and you need a specific time, please contact me, because I can always try and wiggle things round for you. That's not a problem. I understand that everyone's busy and they've got their own lives, so don't feel like you can't contact me at all. I think I'm quite a normal person. Other people might say otherwise, but I think I'm quite normal. So just give me a message and I will see, especially if you've got a couple of days where you think, oh, I could do this day, or this day, just message me. It's not a problem. And then we can go through it if that's a good option for you. Hi, Billy. Nice to see you. You've just missed me blagging on about Lumiere. So, oh, gosh. But I'm not going to mention it anymore. And by the way, this is, for those that are just joining now, this is not alcohol. This is glorified apple juice. Okay, I just ran out of wine glasses. Out of normal glasses. So The other things also to mention is what kind of skin conditions I deal with. And the answer is absolutely everything. Um, the only thing really would be a form of cancer. I have dealt with skin cancer. I've excised it and removed it and treated it effectively, but that's been in the NHS and it should stay in the NHS. So if I did see a skin cancer, then I would tell you to go see your GP immediately and get referred in. Other than that, all skin is free. You know, it's free game. Free game, is that the term? I have no idea. But yeah, I will do all of it. So if you've got acne, I will deal with it. If you've got acne scarring, I will deal with it. If you have hormonal changes because you are menopausal, or you've got polycystic ovarian syndrome or PCOS, I'll deal with that. Rosacea, acne rosacea, I'm here for you. We can definitely treat that. If you've got melasma, if you've got aging, pigmentation, fine lines, wrinkles, areas of jowling, for example, as we get older, which is where this area starts to sag. Because I'm an ears, nose and throat surgeon, there will be in the future some time where I will be doing rhinoplasty, so injecting into the nose to help with improving the appearance of the nose. I'm used to doing operations to treat the nose that way, but now it will just be it won't be surgical, it'll be non-surgical. Obviously I can't do that in the middle of Horsewith, that would be a little bit dangerous. So yeah, so I do most skin conditions, and the other thing I'm really quite passionate about is different types of skin. So I will do, I'll come back to you, Lorna, don't worry, I have just seen that. I will do all skin types, whether that be white skin, brown skin or dark skin. I will also do all skin tones and textures, dry skin, combination skin, oily skin. Doesn't matter to me. I will treat all of it. I love a challenge. Please give me the challenge. And just going to switch now to some of the questions, because I really don't think you want to hear me just talking on and on and on. Lorna, you just written, what treatment's best for aging skin texture? Okay, so you start from the bottom and you work your way up. So the first thing would be, it's not a treatment as such, but I always start with your general health, making sure you're eating right, you're drinking plenty, keeping up with hydration, making sure that you're looking after your body and that you're not drinking to excess, making sure that this isn't related to hormonal changes. For example, if you were going through menopause, which I don't believe you are. And then once we go through that, we form a full skincare routine that involves making sure you're on the right cleanser that's gentle and hydrating. Illumier, Millie, has got lovely cleansers that are perfect for this. Then you want to add in hydration, vitamin C to help improve the skin barrier and hydration. And you want to add in either a alpha hydroxyl acid, an AHA, or a BHA. I won't go into that in this, but basically it's helping with removing excess skin debris. You're not an old git. You're not an old git, Lorna. You're not. You're not getting old. Don't be silly. And don't forget, when you're getting old, I'm getting old. So don't worry. And essentially, we will use exfoliating treatments through your skincare to help with that. You also want to hydrate with hyaluronic acid. You want a vitamin C, and also you want a retinol, because that's going to help lift pigmentation and also improve cellular regeneration to help with skin texture. Treatment wise, I do a mixture. I love chemical peels or resurfacing treatments. They're not as scary as what they sound at all. You are not going to have your face peeling off like something out of a horror movie. And what it's going to do is it's going to help resurface that skin where you've got abnormal texture. And as well as that, microneedling. So microneedling is where we put little punctures inside your skin in order to boost the inflammatory process so that it repairs, so that you get improved texture that way. And then for any areas of fine lines, we can do very, very superficial skin boosters and polynucleotides to help boost collagen. Is it possible to get rid of acne scarring with any of your treatments? Yes, Rachel, it is. Where to start with you? So I would start off with a good skincare routine. That will definitely help. It depends on how old the scarring is, but I do chemical peels and microneedling that would greatly help with scarring. You can also, depending on how old the scarring is, use polynucleotides, and that will help boost collagen production and repair. So there is absolutely a ton of different treatments you can do for acne scarring, and they're very, very effective. So don't just sit there thinking I hate my acne scars, for example. I'd be happy to see you at any time, but I always see you first as part of the skin consultation, because if the acne scarring is also mixed with active acne and an active infection brewing, then I need to treat that before I deal with any scarring, because otherwise it doesn't matter what I throw at your skin, the active infection is going to lead to further scarring, and you don't want that. You want to try and get it as stable as possible so that you can then do those treatments. Can that be done on the body? By can it be done on the body, are you talking about the microneedling, polynucleotides and all of that, Lorna? Microneedling, yes. Polynucleotides, yes. Technically, yes, with chemical peels, but to be honest with you, if it's scarring on the body, I'd probably inject some polynucleotides around it, and that would help boost your collagen. Yes, Lorna, yeah. For the acne treatment, yeah, all over. Oh, Millie, you have to say that because you love me. You have to say I have a wealth of knowledge. Oh, but thank you anyway. Hi, Olivia. Nice to see you. The other thing is vitamin C with acne is really good because it helps brighten and even out the skin tone as well. You want that in order to help with the underlying scarring and stop further scarring developing. So the way I see it with all these different types of skin conditions is, yeah, I can throw a chemical peel at you. Well, not physically, obviously. Yeah, I can needle your face till you look like you've been hit with a cactus. It's completely fine. However, the best way to treat any skin condition is to have a cocktail of different products and treatments inside a clinic with regular review, so that we can target it from multi different areas. Because otherwise, if you just stick to one thing, you're only going to get one type of result. It's only going to address one part of that problem. Whereas if you decide to do a range of different things, which is why a bespoke treatment plan is important, because with me, I would look at your skin and say, okay, well, we're going to start with the skin, get all that acne sorted that's active, and then we're going to go, okay, now that we've got that under control and I can see your scarring, let's go in with some peels. Let's go in with some microneedling. Let's use some polynucleotides. And that's how I would work. I wouldn't just jump to doing a treatment, because I don't think personally you're going to get the result that you want, and I want you to be happy with your treatments. I want you to be happy with your skin, and that means taking into account how best to treat it from beginning to end. And you know, if you have had acne or you are prone to acne, it's something you have to continue. You have to maintain treatment. There's no cure. It's the same with rosacea. It's a chronic condition, and you have to keep reevaluating it and making sure that you're on the right treatment plan. Because as we get older, and also changes in the weather, the environment, pollution, exposure, our skin changes. It's a massive organ. So you are constantly having to reevaluate your skin anyway. For example, I'm pregnant at the minute, hence why I've got an absolute ton of makeup on. I don't usually wear this much, but the reason I do is because I'm 19 weeks now, and I've never had acne in my entire life, but this baby hates me, and has now brought me out in a breakout all the way around my mouth. Because I'm pregnant, I can't use certain treatments, so I'm having to constantly have a look at what I'm using in order to address it. But before, I never had any problems with spots. I never had them my entire life. So I have had to, you know, change and mix things up. And it's exactly the same. Same as if you go to the gym, you might find that when you were younger, doing cardio was really great, but actually as you've got older, you need to do more weightlifting and weight workouts because it helps with your bone composition and your muscle composition. So, long story short, we adapt it as you need it. Now, Amy has written, how frequently would you recommend chemical peels for dry skin with pigmentation? So I'd have to see how bad the pigmentation was first and how dry the skin is. Again, I would always start with skincare first to make sure that we are doing everything we can. There's no point doing a chemical peel that makes you look super beautiful and amazing, but within a week you look as dry as a bone. So I would use a mixture of really good skincare, really hydrating skincare. And then for the chemical peel, I would do a full Illumier chemical peel, which helps to rehydrate the skin. That would include a full face mask as well, usually an aqua infusion mask to help hydrate the skin as much as possible. And then I would look at redoing that every 4 to 6 weeks roughly, but it entirely depends on what your skin needs. For chemical peels, I don't do them as a one-off. I do them as a 3-course treatment or a 6-course treatment. The reason for that is that if you are wanting a transformation in your skin, there's no point doing it once, because your skin is constantly being regenerated every 4 weeks, and it can be even slower as you get older. So you have to keep up with that, otherwise you won't see the results that you're looking for, and I'd just be taking your money, and that's not fair on you, and it doesn't get me the results that I want and you want. Any more questions? I'm just aware that I've literally spoken for half an hour. Do you know, when I started this, I really thought I was going to be on here 5 minutes and no one would be here, and then I would have to leave. Having spoken to myself for 5 minutes and gone, oh, no one wants to talk to me, I better leave. So thank you for actually coming, because otherwise I would have just spoken to myself. I'll just hang on for another couple of minutes and just make sure that everyone is happy, and there aren't any other extra questions. Otherwise I will leave you to enjoy the rest of your Sunday evening, because if you're all going back to work, you will want to just relax rather than hear my voice, because I know it probably will give some of you tinnitus tonight if I carry on. No problem, Amy, anytime. No problem, Olivia. Absolutely fine. Well, I'll give it another minute, but otherwise, yes, you will be able to watch it back there. Don't tell me how, because I am new to this, but apparently there's a way of me putting this on a replay, so I can post that. Bear with me, because I have absolutely no clue how to do that, but I will work it out and I will put it on there for you. It's not a problem. So if that's all, what I would say is thank you so much. I really enjoyed chatting with you all, and I really appreciate you speaking to me on a Sunday evening, because it's not, everyone else wants to just chill out and watch Netflix. They don't want to listen to me. But thank you. If you have any questions at all and you didn't feel confident to put any messages on here, DM me, or you've got my email address or my Instagram. And yeah, just get yourself booked in. Just get yourself booked in, meet me. What you see is what you get, and we can go from there with any problem that you have. Okay? Well, you'll have a really good time tonight, and I will speak to you soon. Enjoy your proper wine while I enjoy my apple juice. Bye.